You know, we all love to look and feel our best, and there's so many unique ways we can do that these days. And of course, joining me now is one of our coastal experts to talk about facial rejuvenation with Coastal Empire Plastic Surgery, Dr. Michael Huntley. Hi, Dr. Huntley. It's great to see you. So facial rejuvenation, what exactly is that?
Facial rejuvenation is about restoring a younger appearance. Once we've reached a certain age, the effects of aging are inevitable. We tend to get a turkey gobbler neck, we get the jowls along the jawline, we get prominent nasolabial folds, marionette lines from the corner of the mouth, the brow falls, the eyes tend to get puffy and relaxed. And basically, facial rejuvenation is about reversing those effects of aging.
And there's so many things that you can do for this. A lot of options out there are available to restore appearance. Can you talk about those?
There are basically two issues. The skin deteriorates and it loses its elastic qualities, and we also lose volume in the face. So it's a two-pronged approach. You want to restore volume with fillers, and you want to tighten up the skin with non-invasive techniques if you can. Beyond a certain point, those non-invasive techniques have limitations, and that's where surgical correction becomes a more appropriate treatment.
So you mentioned non-invasive techniques. So how do fillers and neurotoxins actually work?
Fillers basically put volume back where it's been lost, in the cheeks in particular, to lift the cheeks. It can diminish the nasolabial folds. It can help with the marionette lines. You can restore volume in the lips as well. Lips tend to shrink as you get older, and some volume restoration can help produce a younger appearance. Neurotoxins are used to paralyze muscles that cause wrinkles. The most common areas that we use them are the glabellar area, where we get these H lines or vertical lines. We can use it for the crow's feet as well. Sometimes in limited areas on the lip, you can reduce some of the central wrinkling that occurs there.
And sometimes, but here's the thing, I mean, so there's a lot that you can do that is non-surgical, but what if someone needs something a little more dramatic?
Right. If you're looking for maximum improvement, then surgical facelifting is the way to go. It does involve an anesthetic, it involves an overnight stay in our facility for safety purposes, but basically incisions from the temporal area down around the ear, hidden behind the ear contour, up behind the ear, are used to elevate the skin over the cheeks. We also lift the fat pad. That's the malar fat pad, which tends to drop, and we pick that up and resuspend it in its normal position. We tighten up the muscles in the neck as well, those vertical ridges that you see in an older person. We use techniques to tighten up the muscles, and then separately we tighten up the skin.
So we've talked about non-invasive techniques and also a surgical facelift, but there are other techniques as well that can help with rejuvenation. I mean, can you talk about some of these new techniques like Ulthera and lasers and peels and also PRP lift?
Right. Ulthera is probably the most effective non-surgical technique for rejuvenating faces and necks. It's basically focused ultrasound. It involves application of pinpoint areas of focused ultrasound that goes through the skin into the subcutaneous layer, and it tightens up the collagen below the skin, and it also treats at 3 millimeter depth, which is the deeper elements of the skin, and then a superficial treatment for the very top layer of the skin. So you're really treating 3 layers when you have an Ulthera treatment. The results come on gradually over 3 to 6 months, and it's continuous improvement over that time, and can have quite a dramatic improvement without a lot of downtime. There's minimal downtime with Ulthera.
What about lasers?
There's a whole host of lasers that have evolved through the years. Fractionated laser therapy is currently quite popular. What it does is punch microscopic holes in the skin, and as things heal, it tends to shrink the skin and tighten things up. You can do the same thing with microwave technology. Focused Cineron makes a nice machine that does the same thing with microwave energy that punches microscopic holes in the skin and gets the same effect.
And then, of course, the peels and the PRP lift.
Right. There's a whole collection of peels that can be used. Some are mild peels with minimal downtime. Some are a bit more aggressive and can achieve a better result. But basically, If you're going for maximum result, there's going to be a little bit more downtime with any of these procedures. The PRP lift is a platelet-rich plasma lift, and it's basically you spin down your own blood, you decant everything except the platelet-rich plasma at the bottom of the tube, and that's applied to the face and micro-needled to put this PRP product underneath the skin and into the skin. And it has a lot of growth factors in it, which helps stimulate collagen production, and it rejuvenates the skin. It's quite remarkable how well it works.
Well, bottom line, there are so many options out there to make it so that you can feel and look your best and get that rejuvenation you need. And you guys are the experts at Coastal Empire Plastic Surgery. Thank you so much, Dr. Huntley, for joining us today.
Thank you very much for having us with you today. Thanks.
It's always great to see you. If you'd like more information about facial rejuvenation or Coastal Empire Plastic Surgery or any of our Coastal experts, just check out our Coastal Experts page. You'll find that at WSAV.com.